Karen McMahon with Pig Health Today, and I'm visiting with Dr. Egan Brockhoff. He is the veterinary counselor at the Canadian Pork Council. Thank you for visiting with us today. And you, at the 2021 Al Lehman Swine Conference, you were awarded the prestigious Science and Practice Award. Congratulations.
Thank you.
You spoke at the conference about compartmentalization and zoning and applying that to control of African swine fever or how to manage an outbreak. Can you put that in layman's term for us?
What we're proposing is an African swine fever-free compartment, and those compartments will be supported by a compartmentalization program. So that's taking animal subpopulations and dividing them geographically. So we have these zones or regions, and they are, we have the diseased area and the non-diseased area, and so we zone, and that's a geographical tool. Compartmentalization is a management system using primarily external biosecurity. So we take all of the efforts that the farm is doing for external biosecurity, and we keep the disease out. We support that with surveillance. We support that with traceability. When we move the pigs to slaughter, we support that with segregation within the slaughter facilities. But it's a management system. Zoning and regionalization, you know, the Federal Veterinary Authority takes care of that, right? And so they come in, they put in movement control, they have the authority. You know, we do zoning after disease has been discovered. So we can approach trading partners to say, hey, we have got ASF-free compartments. We are going to do all of this to ensure they are ASF-free from the moment they're born to the moment they get to slaughter, and then all the way through slaughter to export. And so then the goal is, if ASF is found in the country or the zone or the region, there's no market disruption.
So that is all in theory.
Mm-hmm.
I mean, this has not been set up. So your purpose for being here and talking about it is you're broaching this subject with everyone. And
so you're right. It is, we don't have any African swine fever-free compartments anywhere in the world yet. We do have recognized disease-free compartments in other species for other diseases, and those are recognized. We have some great examples recognized throughout the world already. This would be the first swine compartment, and it would be specific to African swine fever. And African swine fever turns out to be a really good virus for this type of approach.
can you explain to some of the drawbacks of this?
Compartmentalization requires industry to take a leadership role. With zoning, regionalization, government takes control. And that's also a challenge. With compartmentalization, it's a private-public partnership. So industry is the driver behind that. Industry is the one that has to administer the program. The farms have to follow the standards for biosecurity, for traceability, for surveillance. So there's a cost to that. If your farm already has, a good biosecurity program in place, the cost of adopting compartmentalization is probably largely just going to be the cost of doing surveillance. But if you have no real biosecurity infrastructure, no structure, then you have to start from ground one. So, when you think about that, it is an increased cost to enhance your biosecurity, but it's also providing value and benefit to the sites.
It needs to be set up prior to African swine fever coming in. So are you feeling pressure to get that going? And what would that take?
We're feeling a lot of pressure. We have a lot of stakeholders in Canada that have expressed interest in getting going as soon as possible. So today, after a year and a half of working with a standards working group, a framework governance working group, and then a slaughter plant segregation working group. We have a set of draft standards completed. They are being sort of the final edits and translation right now being done within the Government of Canada, the CFIA. Then they'll go out for a 90-day comment period, and we can then review those comments. I mean, we're really hoping we can have our first compartment application sometime early in 2022. We still have to then build a program to support that, and we have to decide who's going to build that program. But I think we've got a lot of positive ideas with that, and have a good idea what that could look like.
Have you heard any interest from the U.S.?
We've presented this project over the last year and a half to a number of different U.S. colleagues. And yeah, there has been significant interest. You know, the concept makes sense to the swine community, makes sense to the swine veterinary community. We know we have the tools. We know we're capable of doing this. In North America, we've got great veterinary infrastructure. We have producers that understand biosecurity. We have good infrastructure to support this.
Just really clarify that the compartmentalization, that they can be close to an outbreak area, but those separate sites are the pieces of that compartment. Can you kind of explain that?
Yeah, so, you know, your compartment could be spread out over multiple districts, multiple states or provinces. You can have half of your compartment within an infected zone, half of your compartment outside of the infected zone. And as long as you maintain those standards, you're still able to move product. So, you know, one of the beautiful things about it is when we do a network analysis of how complex pork movement is within North America, within Canada and the United States, you know, we need that ability to say, okay, we have an ASF positive site 15 kilometers down the road, but our compartment remains intact, it remains free of ASF, and we're still, you know, more than capable of selling ASF-free pork to our international trading partners or domestically.